Hello everyone, this is Dr. Sushma Sarala, consulting homeopath at Fidicus Homeopathy. Today we are going to discuss about a very important topic. Why are we discussing about this topic is because of its prevalence. That is, it is a female topic where 6 members out of 10 women suffer from this. That is nothing but dysmenorrhea. So what is dysmenorrhea? It is nothing but painful periods. Many people might have been thinking, see, painful periods is so common and it's like it is nothing to worry about. Remember, painful periods or dysmenorrhea is of two types. So the primary type, nothing much to worry, but the secondary type of dysmenorrhea is very important because it arises from some female reproductive organ deep issues. So let's discuss in detail. If you are suffering from dysmenorrhea, please do evaluate the signs and symptoms we are discussing, so that you will be knowing if you are suffering from primary form of dysmenorrhea or the secondary form of dysmenorrhea. Let's dive into the topic. What is dysmenorrhea? Dysmenorrhea is painful menstruation. How is it characterized? It is characterized by pain in the lower abdomen, that is your pelvic area. It can have extensions, that is, it can extend into your thighs or into the back, that is the lumbosacral part. Okay, and it can be divided into two things, that is primary dysmenorrhea. See, it can be divided into primary dysmenorrhea, which is nothing to worry about and it is absolutely common in certain section of people. But secondary dysmenorrhea is caused by different conditions in female reproductive organs. So this is dysmenorrhea and it has two types. Now, what are the signs and symptoms of dysmenorrhea? Here, especially if you are suffering from dysmenorrhea, do evaluate the type of pain while we are discussing in this video. Here in this video, we will be discussing about primary and secondary dysmenorrhea. So, first we will be discussing about the primary one. Location. See, the primary dysmenorrhea is located in the hypogastric region. It can have extension to the thighs as well as to your back. Okay. Secondary dysmenorrhea, what is the location? Usually, secondary dysmenorrhea also will have the same location, that is the lower hypogastric region. It can extend into the thighs or into the back, but certain section of people it can extend even down and it can be a little bit more painful. The extension can be a little bit further down, and also they can have this lower bearing down sensation as well, that is something is being pulled out from the uterus. This sensation can also be present, but usually the location is same for primary as well as for secondary dysmenorrhea. You cannot differentiate based on pain. Timings. You can differentiate primary and secondary dysmenorrhea based on pain timings. Remember that the primary one, which is very common, occurs 1 day or 2 days before the actual menstruation. Okay, and then it peaks during the first day, that is the first 24 hours of menstruation, and then it can stay up till the second and the third day, and it will slowly subside. As soon as you finish off your menstruation, the pain also will subside and there will be absolutely no pain after menstruation. This is primary dysmenorrhea. Then secondary dysmenorrhea timings are very, very important. The secondary dysmenorrhea, the pain will start a week or 6 days, 7 days before menstruation. For some people, they can experience high intensity pain. For some people, it will be very low, dull, aching pain. It can start anywhere between 3 days before to 1 week before the actual menstruation. It can be high or low, but there will be, continuous pain. And then after that, during the menstruation, the pain will be severe and it will continue even after menstruation. There can be dull pain, there can be intense pain, okay? But it will continue, during the menstruation and after the menstruation also. This is a characteristic feature. In some people, the pain will increase as the flow increases. Okay, the pain will start to increase as the flow increases in secondary menstruation. In primary menstruation, the pain will peak in the first 24 hours and it will slowly start subsiding on the second and the third day. Scale should go down, but in the secondary menstruation, the pain will go high during the menstruation. It can be maintained or it can decline, but the pain will still be there even after menstruation. That's a characteristic feature. Intensity, as I told you, primary will peak in the first 24 hours or in the second or the third day and it should subside. But the secondary one, the peak can be anywhere between the first week before the menstruation or during the menstruation, and it can also continue as well. Changes in pain pattern. If you are someone who is experiencing pain during menstruation, so what you should note, the first thing you should note is if there is any change in the pain pattern. That is, if you are someone who is experiencing pain during menstruation and the pain is slowly starting to continue even after menstruation, or the pain has increased, that means the threshold for pain You are, if for example, if 5 is the pain scale and you're experiencing 2 in the pain scale radar, but now you feel that the pain has increased a lot and there are a lot of clots or there is irregular menstruation, any change in pain pattern, any change in your menstruation pattern, do get a doctor consultation as soon as possible. Next one is pain outside the menstruation, which I already mentioned, that the pain will continue even after the menstruation in secondary dysmenorrhea. See, as I told you, the pain will continue after menstruation. It is not, compulsory for every person who is suffering from inert problem to have this pain. Where you should differentiate is that if there is any pain pattern change, first thing. Second thing, any pattern change in your menstruation, you have to differentiate. And also, if there is any other associated, symptom along with it, that is irregular period, or there is no period at all for 2 to 3 months, any changes in the normalcy should be evaluated by a doctor. Okay, then what are the other signs and symptoms? In primary menstruation, some people can experience PMS, okay, where there will be nausea, vomiting before 1 or 2 days before the menses, and it can continue during also. Some people will experience diarrhea, some people will experience headache, fatigue, dizziness, breast tenderness as well. These symptoms can also be in the secondary dysmenorrhea. So these are the common symptoms of primary as well as secondary dysmenorrhea. So what are the differences in the primary and secondary dysmenorrhea? So what are the other signs and symptoms that you should be looking for is that abnormal uterine bleeding. That is, if you're experiencing a lot of period, that is prolonged period or diminished period or period in between the periods, that period frequency has increased, anything which is abnormal, dyspareunia, that is if you are married, painful coition or painful intercourse, and vaginal discharge, if it is mucoid in nature or if it is sticky in nature, if it is offensive in nature, if the color has changed, any of these symptoms, any of the systemic symptoms like nausea, vomiting, headache can also be there in secondary symptoms, secondary dysmenorrhea, as we already mentioned. Infertility. Some people might be trying to get conceived, but they are not conceiving, and there is pain radar increasing, and there are other symptoms associated with it. Please do take a doctor consultation as soon as possible. Other symptoms like, if there is any bleeding or pain while defecating, or if there is any pain while urinating as well. See, there are certain conditions called as endometriosis. These are the symptoms like pain in the rectal region while passing or defecating, or pain in the urinary bladder while passing urine is also present. If you're having any of these features as well, please do get a doctor consultation as soon as possible. Next, coming to the investigations part. If you're experiencing any of the signs and symptoms we have already discussed in the secondary dysmenorrhea part, that is abnormal bleeding, it can be any irregularity from the normal, then you should be doing a doctor consultation. And when you're going to consult a doctor, first thing that they will be doing is taking the history and the physical examination. What is taking history? They will ask you what was your last period, how was your last period, how was your before last period, and then any changes that you have experienced over the period of time, your genetic history, all of this stuff will come under play. And then they will do physical examination. If needed, they can do a bimanual examination, and then they can also palpate your lower abdomen region for pain. After doing all of this necessary things, they will be advising you for some investigations. So let's see what are the investigations. If you are suffering from signs and symptoms related to the secondary dysmenorrhea, they can ask you for investigations. The primary one being pelvic ultrasonography. If you are experiencing any of these abnormal symptoms, first and foremost thing that every doctor will advise you is go for pelvic ultrasonography or USG abdomen and pelvis, as we know. So if there is any problem, it can be primarily detected in this USG. If you can't detect anything, or if there is a question mark, sometimes the radiologist puts a question mark, like go for an MRI because we are not able to diagnose the condition properly, then you can go for an MRI to know what it is. And then after MRI, if they are not able to make a proper decision and they want to view it betterly, they can do a laparoscopy as seen in the picture, as you can see in the picture. See, by doing laparoscopy, what they can do is that they will be able to view if there is any PID, that is pelvic inflammatory disease, which is also a cause of secondary dysmenorrhea. They will be able to view in a better manner and to see what the problem is actually. Or if there is any appendicitis and not true menstrual problem, so they will be able to differentiate, and also they will be able to predict what is the cause of the secondary dysmenorrhea. Apart from this, there are certain things that you need to do. such as laboratory investigations, which include CBC, which is complete blood count. Why do you need a complete blood count for pain? Is that, see, if there is any sort of inflammation in the body, there is raise in the WBC cells, that is white blood cells. To know if there is any sort of inflammation in the body or infection in the body, you need to do CBC along with ESR, that is erythrocyte sedimentation rate. If there is any active infection, there can be increase in the pain scale without any problem in the female reproductive system. So to differentiate if it is a female reproductive problem or a systemic problem, we have to do CBC and ESR. Apart from that, we should be doing gonococcal and chlamydial cultures. If there is any sort of difference in the thickness of your white discharge, color of your white discharge, or the order of your white discharge. Okay, so we have to check for gonococcal and chlamydial infections, because they can also lead into or cause a little bit of pain or increase in the pain index during menstruation, and also they can cause itching. Because gonococcal and chlamydial infections, we have to do this culture to know how they are affecting, or is this being related to the pain. Next is the human chorionic gonadotropin is the next test, which is HCG, which is very common that we do to predict pregnancy. So how is pregnancy related to this secondary dysmenorrhea is that if you're pregnant and if you're ectopic in nature, the pregnancy is ectopic nature. What do you mean by ectopic pregnancy is that the implantation usually, that is the fertilization, that is the ovum and the sperm meeting together to become a zygote happens in the fallopian tube, and then it should come down to the body of the uterus to attach itself. But if it is still there and it is growing in the fallopian tube, that is the fetus is growing in the fallopian tube, it has to be removed and it will cause severe pain. So this can also be evaluated by HCG. And then erythrocyte sedimentation rate, which we have already discussed in the CBC part. Urine analysis to know if there is any UTI associated, because UTI can also cause pain, and in the if you are menstruating during the UTI attack, the pain index can increase and there might not be an actual problem in the female reproductive system. So all these tests are to differentiate if there is any problem in the reproductive system or is there any problem in the surrounding tissues. And then even stool examination as well to know if there is any problem in your colon. So these are the basic tests that you need to do to differentiate it. Now coming into the structure and functional part of the uterus or the female reproductive organ. So why should you know about the structure and functional part of the female reproductive system is that, say if you know the basic things, you will know where it is going wrong and how it is going wrong, and how can you prevent it if you are a female who hasn't experienced this, how to prevent it, and if you are a female who is experiencing this, how to cure it and relieve it. So let's get into the topic. So this, as you can see, is the female reproductive organ. These are the ovaries, this is the fallopian tube, this is the uterine part, and this is the cervical part or the cervix and the vagina part. Okay, so the ovum usually is released by the ovary, it is picked up by the fallopian tube and it will stay here. Okay, so what happens if there is intercourse, the sperm has to travel here until here and meet the ovum. Okay, and then when the ovum is met with the sperm, it will become a zygote, that is a living cell which will be able to divide. And when there is certain division, it should come down and attach here. You understand, it should attach here. Okay, and then after attachment here, it should grow big, and then there is delivery. But it does not happen regularly, right? So what happens when the ovum is released and it stays here? It stays for the sperm, and when there is no fertilization, that is when there is no sperm meeting with the ovum, there is no zygote formation. And what happens is, when the uterus is always prepared for pregnancy, that is what happens, there is 30-day cycle, right, or your 28-day cycle. What happens is that first day of your period to the 14th day, and then from your 14th day to the next day of your period, there are two phases in it. Okay, the first phase is called as the follicular phase, the next phase is called as the luteal phase. In both of these phases, what the endometrium will do is that is the lining of the uterus, it will become thick so as to be prepared for pregnancy. When this zygote is not forming, when there is no fertilization, this endometrium which has grown thick so that it will carry the baby, because the baby is not there, it will start to come down, which is menstruation. Okay, when it is coming down, it will have certain chemicals released, that is why there is pain. Okay, So we will explain it in the body changes part, why there is pain in the primary dysmenorrhea and why there is pain in the secondary dysmenorrhea. Now coming into the causes and risk factors. If you are someone who is experiencing pain during the periods and you are watching this video, remember that we are discussing causes and risk factors. If you are coming under any of these causes or risk factors, do take a doctor consultation as soon as possible. The first one we are discussing is the primary dysmenorrhea. So, in primary dysmenorrhea, usually it is because of a certain prostaglandin mechanism and the uterine contraction. Remember, I told you that in the structure and function, the endometrial thickness will be there so that they want to carry the baby. The uterus wants to carry the baby. When there is no baby, the endometrial thickness should be shut down. And how is it shut down? It is pushed down through the uterine contractions. Okay, so by this uterine contraction, by the release of prostaglandin, and sometimes you do not even know why it is happening without any pathological cause, so that comes under primary dysmenorrhea. Okay, these are the causes, that is increased prostaglandin mechanism. Prostaglandins are present in every female, but there is increase in the females who are experiencing dysmenorrhea or painful menstruation. So increase in prostaglandins and severe uterine contractions can cause dysmenorrhea, that is primary dysmenorrhea, which is absolutely fine, nothing much to worry about it. Next, coming into the secondary dysmenorrhea part, why does it occur is that any problem like endometriosis. What is endometriosis? The endometrial layer which should be present inside of the uterus, if it is displaced anywhere, it can be displaced throughout the body, or if it is going inside the uterus, if it is going through the rectum, if it is going to urinary bladder, anywhere, if it is being deposited anywhere, that is called as endometriosis, which can be very, very painful. If you want to know more about endometriosis, you can check out our videos. We have already discussed about it. And then even uterine fibroids, that is a tumor-like growth in the uterus. This can also cause secondary dysmenorrhea. Adenomyosis, if the endometrial tissue is going deep into the uterine wall or the muscle of the uterus, that is also very painful. It is called as adenomyosis. And next, PID, which is pelvic inflammatory disease, can also cause secondary dysmenorrhea. And then other conditions, it can be any other female conditions like PCOD, can also, or ovarian cyst, chocolate cyst, all of these can also cause severe pain or secondary dysmenorrhea. So these are the causes and risk factors. Now coming into the body changes part. As you can see here, this is the female reproductive system. Here we will be discussing why you have primary dysmenorrhea and why you are experiencing secondary dysmenorrhhea. See, as we've already discussed in the structure and functional part, that the endometrial thickness was increased so that they're anticipating a baby. The fertilization is not occurring, the endometrial layer should come down, right? This layer inside the uterus, what is it called? It is called as the endometrial layer. And this layer will release prostaglandins, okay? So PEG alpha and then PEG1 or PEG as such, prostaglandins you have to remember basically, these will be released, okay? So what do these prostaglandins do? If you have to get rid of this endometrial thickness and it has to come down, the uterus should have contractions. Same manner like if you are eating food and the food should travel from the stomach to your rectum. Okay, it should have peristalsis, that is muscular movements, so that the food is moved from from your esophagus till the rectum. There should be certain movement. From the esophagus, it will go to the stomach will churn and it will send to the duodenum. From duodenum, it will have peristaltic movements to send to the rectum. In the same manner, for this endometrial layer to come down, you need uterine contractions. These prostaglandins are usually released. What will they do? Their work is to cause this uterine contractions, and also they will cause vasoconstriction, that is the blood supply. Usually what is vasodilation is that if this is the cross section of the blood vessel, what do this prostaglandin do is they constrict the blood vessel, they make it smaller. Okay, making it big is called vasodilation, making it small is called vasoconstriction. Sometimes this prostaglandins will cause so severe form of uterine contraction that it will usually press the blood vessels which are supplying it. The blood vessels usually get up pressed, okay, and this pressure or this pressing sensation will cause severe pain. That is why you will be experiencing pain in the primary dysmenorrhea. So what is happening is that the prostaglandins are released, and usually contractions happen in certain section of people and do not experience any sort of pain. But in some section of people, especially people who are experiencing dysmenorrhea, there is increase in prostaglandins, and this increase in prostaglandins will cause severe form of uterine contraction, which will cause vasoconstriction, along with they will press the blood vessels because of the severe uterine contraction. And by pressing those blood vessels, there will be severe pain, and the uterine contraction itself is also very painful. So this is the main reason for primary dysmenorrhea. And then what happens in the secondary dysmenorrhea? What happens in the secondary dysmenorrhea is that any endometriosis, that is endometrial layer being deposited anywhere, or adenomyosis, this layer going inside, or fibroids, that is tumors happening, all of this will cause certain factors, or pathologically they will run certain symptoms in the uterus, which will cause the uterus to have a lot of pain. Okay, the pain index will increase. So it is different for each and every disease. The pain pattern or the cause of the pain for endometriosis is different. The cause of the pain for fibroids is different. The cause of the pain for adenomyosis is different. Cause of the pain for ovarian cyst is different. Cause of pain for PCOD is different. So all of this together will have painful or very, very painful menstruation, or dull aching pain throughout the menstruation and after the menstruation also. Or they can cause symptoms like abnormal uterine bleeding or irregularities in bleeding. If you have any of these symptoms, do not neglect them. So these are the body changes that occur. Now coming into the conventional treatment part. So we have already discussed that primary dysmenorrhea is not something to be worried of, but you do experience nausea, dizziness, vomiting, breast tenderness, mood swings, and severe pain even in primary dysmenorrhea, even if there is no any pathological entity attached to it. So what do you do? Usually, especially here, we take Meftal spas, or we take some medicine, so that there will be decrease in pain index. If you're taking any Meftal spas or painkillers, there is they will suppress the pain, but there is no addressing to the cause, where there is a prostaglandin mechanism is going wrong, that is increase in prostaglandin mechanism, which is obviously causing the pain. And also they have their side effects attached to it. That is, if you are taking painkiller for a longer period of time, that is using painkiller for longer period of time. Recently also we have seen news on Meftal spas, where it is causing certain section of people certain symptoms which are not to be caused in healthy individuals. So every painkiller will have certain effect, and also by taking painkillers, your gut bacteria can change. You can have gastritis, you can have associated side effects attached to it. So if you are taking conventional form of treatment, that is allopathic form of treatment, even for primary dysmenorrhea, and this primary dysmenorrhea, this pain, even if you are taking a painkiller, you have to take this painkiller every menstrual period. That is, every time you're experiencing menstruation, you have to take this tablet. But if you're choosing homeopathy, the case will turn out differently. How it will turn out, we'll discuss in the homeopathic part. But remember, you will have side effects, and also there is no decrease in the pain scale unless and until you're taking this medication. And also you will be experiencing pain in every period. These are the problems associated with allopathic form of treatment. They can give you NSAIDs if you are suffering from secondary dysmenorrhea. They can give you hormonal contraceptives. They can give you other medications like gonadotropin releasing hormones elsewhere, like especially this gonadotropin release hormones are useful for endometriosis type of pain. So these medicines are a mixture of primary dysmenorrhea medicines and secondary dysmenorrhea medicines. Okay, so if you are taking these medicines for primary dysmenorrhea, I've already told you the side effects. For if you're taking it for secondary dysmenorrhea, remember, allopathy does not offer a best shot at hormonal disruption, or a best shot at fibroids, or a best shot at adenomyosis, PCOD, or ovarian cysts like homeopathy. All their medicines which are hormonal in nature will have side effects, and also if you stop taking this hormonal tablets, you will have recurrence in the symptoms, and the symptoms can get worse. So these are the effects of conventional form of treatments. Next, coming into the homeopathic form of treatment. Should I be taking homeopathy for my primary dysmenorrhea? Let us first discuss primary dysmenorrhea. Yes, there are beautiful medicines which will decrease the pain in the uterine contractions, or there will be decrease in pain as such if you take homeopathic medications. And if you are taking proper constitutional medicine, the pain scale, if it is 5, it will go to 4 in the next 2 periods, and it will go to 3, 2, 1. After certain period of time, there will be no pain associated with your menstruation, which does not happen in allopathic form of treatment. So in homeopathy, you will experience this kind of beneficiary effects. That is, there is decrease in pain, there is decrease in recurrence of this high scale pain, and also there will be no side effects, which is very, very important. And then coming to the secondary dysmenorrhea part, if you are experiencing secondary dysmenorrhea, pain due to any female reproductive problem, as I already told you, allopathy does not have a good shot at it because it has hormonal medication. Hormonal medication, if you're taking it, it is fine, but it has side effects to it. That is, it can cause a lot of weight gain, or it can cause weight loss, it can cause skin changes, it can cause hair fall, it can cause acne in some people. And also, if you stop taking this, there will be intermenstrual bleeding, that is bleeding in between your periods as well. And also, it will not cure the case. But in homeopathy, we have medicines, we have good number of cases with very high success rate, where the fibroids, are coming down, going, the tumor is decreasing, the PCODs are decreasing without any side effects. The endometrial symptoms are much better after using homeopathy. So try to use homeopathy, which is much safer, much effective, which does not have side effects, and also it will cure your problem, it will prevent further recurrences, and also it will relieve your current symptoms. Now let us get into the other treatment options and precautions. See, there is not only one medicine or one system of medicine which will cure everything. There is certain combinations that you need to mix when you're treating certain diseases. Certain diseases need a combination of medications. So if you're someone who is suffering from dysmenorrhea, it can be primary, it can be secondary. There are some precautions that you need to do, and there are some other treatments that you can take. The primary one being massages or relaxation techniques or reflexology. You can go to a spa where they will be pressing certain centers on the foot or on the hand, where it will give you pain relief. Okay, so reflexology or massages can really help you. Apart from that, you can also take acupuncture, which will also decrease this pain scale. So if you're someone who is looking for relaxation during the high period pain, you can do a combination of homeopathy along with reflexology, massage, and also acupuncture, so that you will get the best of both worlds. Apart from it, you can have heat therapy, that you can fill up the bag, as you can see here, have a heating pad with hot water in it. You can put it in the hypogastric region, or on your thighs, or on the back. Or if you're someone who wants cold things, you can put on cold water in the bag and then put it on your hypogastric region, thighs, or your back. It will also help in relieving pain. Apart from this, what else can you do is that you can do dietary changes. So you can have a little bit more of magnesium, so that it will help in these cramps. Where do this or how will you consume magnesium is that magnesium is found in nuts and seeds. You can take a good amount of flax seeds, pumpkin seeds, watermelon seeds, sesame seeds, cashews, and almonds every day in smaller quantities to decrease the pain. And also, apart from that, you can take transcutaneous electrical nerve stimulation. That is a therapy. They will be giving you small amount of electrical bouts. It is a form of treatment. But what we advise is heat therapy. We are advising you with relaxation techniques, that is reflexology, massages, and we will also advise you with certain workouts, that is stretches, especially to relieve the pain. Okay. And then acupuncture, if it is like very severe, we will advise acupuncture, but it is not something that a homeopathic physician can advise. You have to consult another doctor for that. But acupuncture can also help, and also TENS. So these are certain precautions and certain other treatments that you can do if you're experiencing dysmenorrhea. Now coming into the neglect part. See, if you're someone who is suffering from primary dysmenorrhea, you have to take medications every month, right? If the medication is homeopathic and it does not have side effect, that is nothing much to worry. It will slowly come down and you will be healthy again. But if you're someone who is suffering from secondary dysmenorrhea, it is very, very important for you to take doctor consultation, because there can be some underlying problem in your female reproductive system. So if there is any problem in the female reproductive system and the tumor is growing large, or there is endometriosis, or there is adenomyosis, can progress into a stage where you cannot treat. So if you are experiencing secondary dysmenorrhea symptoms, do take doctor consultation as soon as possible. And also, if you're suffering from primary dysmenorrhea, if you neglect it, what happens? You have to take leave compulsory if you're experiencing severe pain. If you're having some big project, what would you do? You can't take leave then, right? So try to choose medication which will decrease the pain, which will not have side effects. So do not neglect any form of painful menstruation. If you are experiencing changes in pain pattern, changes in the flow pattern, do consult a doctor as soon as possible to maintain good work-life balance, either in primary dysmenorrhea or in secondary dysmenorrhea, and also to decrease your pain, to decrease, to have a healthy lifestyle. Please for a doctor consultation and also take medications for your problem, because to be healthy is the primary goal, to live longer and to be healthy. So do not neglect your painful menstruation. If you're someone who is experiencing pain during every menstruation and you want to decrease it, that is primary dysmenorrhea. And if you're someone who is experiencing pain along with other abnormalities in your flow, that is secondary dysmenorrhea, and you would like to get in contact with us, we have two kinds of consultation options. One is the online consultation, the second one is the offline consultation. If you're someone who's staying nearby the nearest branch of Fidicus, you can come and contact us in person. If you're someone who is staying far away from us, you can contact us online. We have two options, that is audio consultation as well as video consultation. After the audio and video consultation, if we think you are suffering from secondary dysmenorrhea, we will ask you for investigations, or if you have already done investigations, you can send it to us. And after the doctor consultation and after the whole process is done, your medicines will be delivered to your doorstep. That is, home delivery option is available, where if you're staying in India, it can take 3 to 4 business days. If you're staying in USA, it can take 3 to 5 business days. And if you're staying anywhere else, it can take 4 to 8 business days for our medicine to reach your doorstep. If you want to consult us, you can call us on this number. You can WhatsApp us, you can message us, or you can call us. If you would like to know more about Fidicus Homeopathy, you can check our website www.fidicus.com. So if you're someone who is experiencing painful menstruation and you do not know what kind of painful menstruation it is, that is primary or secondary, or if you're someone who is experiencing pain in every menstruation and you would like to get rid of the pain to have a better work-life balance, or if you're someone who is experiencing pain along with the abnormalities, that is female reproductive problems, you can contact us. And also, why should you choose Fidicus Homeopathy? Because Fidicus Homeopathy stands for highest chance of health. Here we have three principles. One is the highest success rate. See, we are already experiencing a rush of patients who are approaching us for different female reproductive problems, and the success rate is really high. It is good. And also, there is transparency in treatment. That is, that there is no gray area between the patient and the doctor. Any sort of prognosis that you should be knowing, we will be letting you know. And also the personal care here at Fidicus. If you have any sort of myths, or if you have any sort of queries regarding your own problem, we will be educating you. And not only that, we will educate you in all aspects of your problem. So if you want to choose cure, if you want to choose a better life, choose Fidicus Homeopathy. Thank you.
Fidicus Homeopathy.